Good morning, my friends from the lovely state of Florida. My name is Gaurav Malhotra, and I'm an MD and I'm an internist and board certified in internal medicine. I am providing some talks locally to the residents of our small town called Spring Hill about the coronavirus, which now is scientifically called COVID-19. Now, COVID-19 is a name given because CO stands for corona, VI stands for virus, and D for disease, and 19 for the year that it was detected in. And it is a new type of coronavirus, although coronaviruses themselves have been around for a long, long time. But as they change their structure and their disease pattern, they are named differently. So initially, we just put a letter N, CO, VI, which means a new coronavirus. But then as we classify them further and we have a firm uh, diagnosis on them that this is what we have, we give them more specific names, and this one's got this name COVID-19. It still is a work in progress as we do not know everything about it, but we don't need to know everything about something in order to fight it. We need to know key points about it, and there are some key points that are part of basic hygiene and basic prevention of contagious diseases, and there are some key points that are already known about the virus which help us in deciding what to do with it. So, being a medical practitioner, of course, it is important for me to protect myself as I examine patients. And when I examine patients, I dictate my notes onto my cell phone. And I have worn a mask here. It's an N95 mask. And I tried to program my iPhone in order to recognize me with the mask on. But Apple, you need to move on with this so that our phones can actually recognize us with some obstruction, because here it says face is obstructed, try removing anything that may be covering your face. Of course I want to cover my face at this time and be able to open the iPhone without touching the screen. So maybe an update will help. That's about me, and I love Florida. I love this beautiful town of Spring Hill where I live and practice medicine amongst the wonderful people that have moved here from all over the country. Of course, the Corona beer jokes are endless, and everybody wishes that this problem had come out of this bottle and we could just cork it back. Uh, of course, I have to tell you that alcohol is injurious to your health, so please do not consume this without adult supervision, a responsible adult supervision. Then, what do we know about coronaviruses? We know that the SARS came to us, was initially called nCoV. It came from cats. Then the MERS, the Middle Eastern coronavirus, came from camels in the Middle East. And the COVID-19 has been known to resemble strongly the virus that comes from bats. And maybe there is an intermediary mammal as well, which some people have mentioned could be the pangolin. And it is called the coronavirus because it looks like a crown. And you can see that some bottles of the Corona beer also have the crown made on it. And there are jokes about, how something that is named Royal Princess or Royal something else in a ship, how would it not have coronas or crowns attached to it? So here we come. It is called the coronavirus because it has spikes. There is a round structure which has spikes, and these spikes are all around the virus, making it look like a crown with the little pokey things from all sides of the crown. And of course, precautions need to be taken in order to prevent the spread of it. And as I mentioned before, that this is a highly resembling virus compared to the bat virus, and um, there are reports of people eating bats. There are reports of people eating other animals that could be intermediaries, which is the most likely way of this virus getting transmitted to us. Of course, there is also this myth going around that it may have come out of the Chinese viral lab that is stationed in Wuhan. And, you know, science is always a good place for skeptics as they question everything that is mentioned by another person until it is 100% verified. So Wuhan is the city in Hubei province, and that's the picture of a pangolin. And patient zero is not known and may have passed away. So what is happening now worldwide is that Wuhan is heavily connected to Wuhan itself has international airport, and that international airport has flights to multiple places. Now, having said that, we feel that the virus spreads by respiratory droplets, so it is suspended in the air for a little bit, and if you breathe into that cloud of virus particles as you walk or stand near somebody, there are chances that you could catch the virus. And of course, longer the period of exposure, higher the content of exposure, which means as close as you are to the person, standing within 3 feet, 6 feet, different uh, distances have been mentioned, higher the chances of you getting the virus. And then of course is contact, direct contact with the expectoration, as it sits on common places like doorknobs, microwave handles, um switches. So these are things that we all need to watch out for. The flush handles, something that is in a common public use place, close crowds, touching each other, hugs, kisses, etc. So we all need to be careful with this as well. Then here's the Wikipedia page on the Wuhan International Airport, which says the terminal is closed. And it was ramped up to have a capacity of 880 people per hour at least. And it could even be up to handling up to 3 to 5 million people a year. So we have to be wary of all this traffic taking place, because the world, as somebody mentioned to me, has become a very, very uh, close or a small place with travel and transportation taking place from so many places across the planet. So I looked up the destinations that exist from Wuhan Airport directly, and then found that there is Kuala Lumpur. And of course, when a flight goes from one place to another, doesn't mean that it's going to fly back to the same destination that it came from. And it's possible that the flight goes further on somewhere with contamination having taken place. Then there's Macau, which is the mecca of gambling in the East and competes with Las Vegas in terms of crowds. And we know that as far as the US is concerned, Las Vegas draws the second largest crowds to conferences and conventions. And of course, the first we know is Orlando in my little state of Florida, which could also be at risk because of travelers coming here. There's Macau. Then Air France has a direct flight to Paris. Then there is to Tokyo, to Hong Kong, to Lhasa, which is in Tibet, Sydney, which is in Australia, into Taipei, Bangkok, Dubai, Istanbul, London, Moscow, Rome, San Francisco. And imagine this, plus there are direct cargo flights from there to Anchorage as well as Chicago. So keep that in mind as you start to think about where the virus is going to spread. If there are direct flights from so many places, because I didn't even read out the others that are within China or within small places that I don't really know where they are, because of them not being internationally well known, doesn't mean that there are not travelers flying in and out of those places, coming through Wuhan and flying out into other places. And places you start mapping in that from these hubs and nodes, as things start to travel left and right within their own countries, it is an insane amount of traffic that has been exposed to the virus at this time. Certainly, we are in a world that is heavily connected, where things are traveling at a pace that living in one little town, can't even imagine. And here's traffic from a couple of airlines within the United States. And imagine that going from San Francisco all the way into Hawaii or other places across the country, as people from one place or another have a connecting flight through San Francisco, through Wuhan, because all these connecting flights, the prices also drop. So what do we do to prevent the spread of this virus? We know that respiratory uh, transmission is possible, therefore avoidance. Avoid travel, avoid unnecessary travel. If you have to go for a business meeting that absolutely forces you to and you cannot telecommute at all, then you know you got to do it. But otherwise, avoid travel, avoid crowded places, as we know that many venues have canceled their large gathering uh, events. So we have to take advantage of this, and maybe there are some now. Even the Pope is doing what is called telecommuting, or making uh, live webcasts of the prayers at the Vatican. So we all have to start thinking in those terms. Our office here in Spring Hill, Little Spring Hill, Florida, also provides televisits. So patients who can actually telecommute with us and televisit with us, either through video chat or even by a phone chat, should do so. And I think it's time that the government allows um, physicians to bill for these visits. Otherwise, they are calling these patients in so that their livelihood at least doesn't get hit terribly, while these physicians are still helping patients who are sitting at their homes. Just calling in and it a national emergency and not making such provisions for people to make a livelihood even without uh, close contact is not going to work. Of course, we have to wash our hands, we have to disinfect. And disinfection, I was looking at Amazon and other websites where I could buy alcohol, which is greater than 60%, and the cost is cost prohibitive. For somebody who wants just a small bottle of alcohol while they disinfect their home, their hands, etc., with a spray bottle, the cost could be upward of $25 just for a small amount. And we have to rethink that we are putting 10% of ethanol into our gas. And why has the government not made this provision to stop that and provide this onto the public at a cost that is dirt cheap? We should drop the price of alcohol and disinfectant so that everybody feels safe. My electronics, my laptop keys, or my PC keys at the office have to be disinfected. I should have 99% alcohol that will not infiltrate and hurt the electronics, and be able to use this without thinking twice about this. Of course, food washing, hand sanitizing, avoiding public places, avoiding touching public places if you are there, avoiding the restrooms in there is also important, wearing gloves, etc. Then, of course, I talked about the N95 mask, which is an important measure. And as we say that we do not need masks, this is something that comes from the CDC and other experts, and I do respect that. But instead of quarantining people, quarantine the virus itself in the person who might be infected, and maybe we could consider that everybody's infected until proven otherwise, and mask quarantine everybody for the next 14 days, provide masks in bulk. I know that there are talks going on with 3M, which is a company that makes masks. I think there should be talks going on with multiple other manufacturers in order to get N95, N99, or whatever mask. Since coronavirus is such a big virus, it can easily be trapped in a mesh. I think even slight amount of masking, even if it is not an N95, might be helpful, but I'm going to defer to the experts in order to provide us this. Plus, if everybody masks up, the viral load getting out there into the public places or common places becomes lesser, and we avoid high degrees of exposure, so that the viral load that we get exposed to is way less than it would be otherwise. Of course, there are these ordinary masks. The utility of N95s is still questionable, but in my opinion, if medical personnel should wear it, I think in order to protect yourself and in order to protect your environment around you, you should consider yourself infected or consider yourself at risk and protect yourself and protect others. As far as symptoms are concerned, there is general symptoms like fever, and of course respiratory symptoms, which is where it attacks into our lungs, is a cough. Most of the times we see a very minor ailment, and it can start within 2 to 15 days of being exposed. And sometimes we've considered that there could be a longer interval even after exposure, as was seen in one of the cases that was otherwise being released after a couple of negative results, but turned positive on the day that the person was released from quarantine. Then a few cases get nausea and diarrhea and vomiting, which are all these non-specific symptoms. The diagnosis is made by isolation, but right now I feel that the diagnostics are at a very preliminary stage where the kits are not readily available. Of course, we all want to make the testing as readily available as possible, and that does not mean that it should be available only in one center, but actually should be provided to uh, physicians at large at a very, very nominal cost in order to find cases and isolate them. Um, Obviously, we are headed towards quarantine in Milan, where 16 million people have now been quarantined. And I am sure China has made an extensive quarantine effort in order to decrease the number of cases that is currently seeing. So it is important that we start to self-quarantine and avoid public places. We start to quarantine the virus by using masks, presuming everybody's infected, and avoid exposure of people who are healthy and have not contracted the disease and thus are not immune. There are reports to say that those people who get the disease thereafter are immune to the COVID-19, but I have not read one that confirms this. So we'll take that with a little pinch of salt. We can make the diagnosis by X-rays, CAT scans, etc., by finding pneumonias on both lungs. Then, of course, there is treatment. There are multiple reports that antiviral drugs do work. So there are anti-HIV drugs. There is the anti-flu drug, uh, oseltamivir or Tamiflu, which has fortunately now become generic, and it's available. There's anti-malarial drug chloroquine, which has shown to have some benefit. And then I also read from what I consider an expert that zinc lozenges may help. So that is something that you can try as well. I do not know if tablets help because you shouldn't be swallowing it. The zinc should be coating your pharynx in order to prevent the easy binding of the virus with the lining. And of course, there is oxygen support and then breathing machines that may be needed in a very few cases, which are the ones that become extremely serious. As a responsible citizen, as a responsible administrator, we all have to see that those who are sick seek a doctor, see a place where things can be diagnosed properly. Protect yourself, protect others, practice non-touch techniques. If you are sick, of course, you avoid contact, stay home. Your greeting should be non-contact for the moment until we isolate this. We should have an alternative greeting in order to express your affection and love for those who you care for. And if you go to a doctor's office, try and stay outside. Now, outdoors with a free wind blowing, the dilution of the virus becomes extensive. So therefore, here I go touch my nose now. Look at that. And so avoid touching your nose, avoid touching places where you could inhale the bacteria. Avoid hospitals. There are sick people in the hospital and we haven't made a diagnosis on them, and sometimes we miss the diagnosis, and that's just human because this is a new thing that's happening with limited resources, without having proper test kits that can tell us immediately. We obviously have hospitals that'll carry a bunch of sick people who have a higher viral load and will infect us. Of course, we must protect our elderly who are even more um, vulnerable to the disease, and it is important that we avoid contact with them. So, make community decisions in order to protect them. Disinfect packages from China, and practice a few uh, clean habits like coughing into a tissue or sneezing into a tissue and discarding it immediately, washing hands, and there are multiple ways of washing hands that people are now proposing. Choose one that you can actually perform uh, without it being too cumbersome, because what is too cumbersome we know does not happen. And imagine that you have a girdle around yourself and don't get your hand above your girdle, which should be at your chest level, to your nose and eyes and mouth area where the mucosal surfaces exist. Of course, we have some good news from our lovely and hardworking scientists. It's one of the most rapidly studied virus at this time. We know the genetics of it. We know how the spike looks like. We've created a vaccine. There are medications for it. The world caseload is advancing. Techniques of control of the virus are uh, excellent now that we have governments involved in the workload. It certainly is a work in progress, and we must respect all those people who are involved in helping community with something like this. Of course, stocking up can create a shortage of things, so try and take only what you think you're going to use in the next few days, and not take up much of the community's resources, that everything including toilet paper, hand sanitizers, everything gets sold. Now, if you were a healthcare worker, of course you want to stock up your office. For instance, I was just speaking to a dentist at a party today, and he told me that they did order excess of masks into their office, but simply because they are so close to the transmission areas from patients that they truly have to protect themselves. Now, what he was unaware of was that they have The the surgical masks, I'm sure that there is some decrease in surge in the viral load by using those, but the true mask that has been advised is the N95 for the healthcare workers. So please allow stuff to remain for the healthcare workers so that they can take care of you in case you or your loved one were sick, and be protected themselves and not create a shortage of people who are there who are caregivers. Of course, a community spirit is key in this. So what should a community do? We, as I mentioned before, minimize public gatherings, gym at home, don't use public spaces which are touched a lot, provide disinfectants in spaces shared by community. We should, as a country, get ethanol out of gasoline and provide it to the public. We should create teams that can help our seniors, and these teams should be made up of younger people who are less vulnerable to severe disease. We should avoid sharing food, avoid sharing candies without individual wrappings. I was just in a party last night where there was candy sitting not in individual wrappings, and of course, most people I realized were avoiding it, which is very responsible. Then place disinfectant near common use areas like doorknobs. I've seen many communities where I've given a talk where that has happened. And of course, watch out for what the CDC puts out for disinfection. In the dishwasher, sanitize with a cycle. Use the sanitized cycle, which raises the temperature to 150 degrees Fahrenheit, and use chlorine, household, just regular household chlorine or bleach. Put a quarter cup of household chlorine into a gallon of water, and that might be adequate if you spray but not wipe it off. So spray it onto the surface you plan to disinfect that can tolerate the chlorine slash bleach, and allow it to dry up. Having said all that, I really appreciate all of you tolerating my speech, and hopefully the slides will help you and some in your community.